But we're talking about otoplasty, cosmetic ear surgery. It's a niche procedure.
Yeah, it is. Because it means that people who are reaching out to us have probably done at least a little bit of research to even know that we do it.
Right.
There's a lot of ways to do otoplasty. Otoplasty is one of my interests. It's not a common procedure. I was taught by a craniofacial surgeon, Dr. John Pauly, an amazing surgeon, and we would do a lot of these procedures there. So
the ear has an external part. The external part has a top part that's called the helix. Below that area, it's the concha that directs sound waves to your middle and inner ear. The antihelix is really the main problem for ears that are prominent. The cartilage there, the ridges aren't normal. They usually get flattened out.
For a standard otoplasty, we make an incision in the back of the ear. We open, expose everything. We do these suture techniques, like one of them's Mustardi, Mustarde. You can look that up. Not alive. Nobody's alive anymore that created all these surgeries, Amy.
Well, it was a long time ago.
Yeah, the upper helix area, there's cartilage ridges there that can be effaced or not developed over time. And that can lead to the upper ear being more prominent. And you can actually create those ridges with sutures or with other techniques.
So Mustardi came up with these suturing techniques, is to use sutures to bend the ear back, okay? And to reshape the antihelix area, give it a more normal shape with the suturing.
If you have a problematic angle from the ear, how far your total ear sticks out. Normally that's a little more acute if that's a real prominent angle. Area of your ear, if you go into behind your ear and you feel that kind of fullness of the cartilage behind, that's the conchal area. You can take that out and suture it down. So for the standard person, it's usually the lack of development or overdevelopment or weird development of the cartilage. And what you do with these less invasive techniques is you try to reshape that helix in a way so the cartilage itself lays like normal cartilage.
The cool part is, if you're an adult, we can do this with you awake. We do it all from an incision behind the ear. We can numb up your ears and do it, and you walk out with you awake. It takes, how long does it take us? About an hour?
Oh, about an hour.
Yeah, at the most.
Yep, it's really not long.
Yeah. You can see that the antihelix, the area underneath the top of the ear, the cartilage there, the ridges are not really prominent and not well defined. See, they're much more defined. And you can get the idea that turns the ear back and also makes the ear shape better. So it's not as pointed, more rounded, and also the angle where the ear comes off from the head is better. Let's talk about recovery. It can be uncomfortable.
What makes it uncomfortable is just because there's really nowhere for swelling in the ears to go, because it is so much cartilage and not a lot of soft tissue. So it's not like a leg or an arm where there's like a lot of soft tissue of muscle and other places for that inflammation to kind of go. So it's tight, and that's what most people end up feeling, is it feels tight. So there's those things that make recovery challenging. Not being able to side sleep for 2 to 4 weeks at least, having to sleep at a little bit of an incline for the first week, and then of course rocking the LeBron James headband.
We do these in the office, local anesthesia, low risk, high gain. People are very happy. So if you have prominent ears, find an expert in your area. Don't be afraid. We highly recommend this procedure. You won't regret it.